Bismillahirrahmanirrahim. In quote for the day, Allah says in Holy Quran, nothing shall ever happen to us except what Allah has ordained for us. The topic for today's presentation is Integrated Management of Newborn and Childhood Illnesses, IMNCI. I am Dr. Ayesha Amin, PGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of my supervisor and teacher, Professor Dr. Saira Afzal, who is the Dean of IPH Lahore. Learning outline for the today's presentation would be Introduction to IMNCI, Objective and Components, Classification of IMNCI, Assessment under IMNCI, Facility and Community-Based IMNCI, IMNCI in Pakistan, Recent Updates, and Multiple Choice Questions. Learning outcome. By the end of this presentation, the participant would be able to describe the concept, important objectives, and components of IMNCI, classify sick children using the color-coded system, recognize journal danger sign requiring urgent referral, facility and community-based IMNCI, and to be able to answer the multiple choice questions. Introduction. The Integrated Management of Newborn and Childhood Illnesses IMNCI case management offers simple and effective methods to comprehensively prevent and manage the leading cause of serious illnesses and mortality in children below 5 years. With IMNCI, sick children or young infants are not only treated for the sign and symptom they present within a health facility, but are also assessed for the other disease condition that may be suffering from. So it has two components. First is the integrated approach to child health. IMNCI treats the child as a whole rather than focusing on a single disease. It addresses the multiple health problems at the same times, including infection, nutrition, immunization, and growth, ensuring comprehensive care, and it focuses on prevention, treatment, and promotion. IMNCI emphasizes preventing disease through immunization and nutrition, treating illnesses early with proper medicine, and promoting health practices such as breastfeeding, hygiene, and timely care seeking behavior. So, the target age group and conditions which are covered under IMNCI in children 2 months to 5 years of age. It treats the children with pneumonia, diarrhea, malaria, measles, malnutrition, and anemia. And in neonates of 0 to 28 days, it treats them if they have the condition of possible serious bacterial infection, jaundice, low birth weight, feeding problems, and hypothermia. So, why IMNCI is needed? Globally, over 80% of the under 5 deaths are due to neonatal conditions, and infectious disease like pneumonia, diarrhea, malaria, measles, and meningitis, often compounded by malnutrition. Most childhood death can be prevented with effective interventions that are feasible for implementation even in resource constrained settings. Before IMNCI, childhood illnesses were managed separately, leading to misdiagnosis, delayed treatment, and poor outcome. IMNCI was introduced to provide an integrated, standardized approach that improves early detection, ensures proper treatment, and strengthens primary health care services. IMNCI was developed jointly by World Health Organization and UNICEF to support countries in reducing child mortality. It provides evidence-based guidelines, training, and technical support to improve child health services globally. The principles of IMNCI. IMNCI is based on following principles. All sick children aged up to 5 years are examined for journal danger sign, and all young infants are examined for the signs of very severe disease. This sign indicates that the need for immediate referral or admission to hospital. Children and infants are then assessed for main symptoms. For older children, the symptoms include cough, difficulty breathing, diarrhea, fever, TB, HIV, air infections, anemia, measles, and malnutrition. A combination of individual signs then lead to the child's or young infant's classification within one or more symptom group. Essential drugs are then used to treat the children or young infants. Lastly, counseling of caregiver regarding home care, appropriate feeding and fluids, and when to return to health facility immediately or follow-up is done. Objectives of IMNCI. The first is it reduces under 5 mortality. It prevents child health through early detection, timely treatment, and proper referral. It reduces morbidity, minimize illnesses, severity, and complications by ensuring correct diagnosis and follow up. It improves the quality of care. It provides standardized evidence-based treatment through trained health workers, promote health practices, encourage breastfeeding, nutrition, immunization, hygiene, and timely care seeking, and it strengthens the health system, improve the drug supply, referral service, supervision, and health workforce capacity. The major components, the IMNCI revolves around three main components. The first is health staff, second is health system, and third is family and community. So it improves the case management skills of health staff through the provision of locally adapted guidelines on IMNCI and through activities to promote their use. It brings improvements in the health system required for effective management of childhood illnesses, and it brings improvement in the family and community practices. Steps of IMNCI. The IMNCI has six major steps. The first is assessment, second is classification, third is identify treatment, fourth is treat the child or young infant, fifth is counseling of the mother, and the last is follow-up cases. And we will look into the detail of every step one by one. So the first is assessment. The assessment column describes how to take history and to do a physical examination. It routinely assesses for the journal danger sign or possible bacterial infection in a young infant. A journal danger sign indicates that a child has a serious and life-threatening condition that requires urgent attention. It assesses for common illnesses in children or young infant by asking questions about common condition, examining the child or young infant, and checking for other routine services such as immunization and nutrition. And it also look for other health problems. So the journal danger signs which are included in assessment are if the child is able to drink or not, if the child has vomiting and he is vomiting everything, convulsions, lethargic or unconscious child, and if the child has a severe breathing difficulty. While the main or journal symptoms are cough, difficulty breathing, diarrhea, fever, or air problem. Classification. So in the next step, the classify signs are classified column of the chart list the clinical signs of illnesses and their classification. Classify in the chart means that the healthcare worker has to make a decision on the severity of the illness. The healthcare workers will be able to classify children or young infant illnesses using the color coded triage system. So it has three colors. The green color, it indicates that the condition is not serious and in most cases no drugs are needed. Simple advice on home management is given. If the child symptoms is following in the yellow box, then the child will be needing specific medical treatment and advice. And if the symptoms of the child shows that it will fall into the pink category, then it is indicated as severe classification, and it shows that the child will be needing admission or pre-referral treatment and then referral to a tertiary healthcare facility. The third step is identify treatment. The identify treatment column helps the healthcare worker to quickly and accurately identify the treatments of the classification selected. If a child or young infant has more than one classification, the healthcare worker must look at more than one table to find the appropriate treatments. Then the next step is treat. The treat column shows how to administer the treatment identified for the classification. Treat means give the treatment in the facility, prescribing drugs or other treatment to be given at home, and also teaching the mother and caregiver how to administer the treatment at home. The following rules should be adhered to. If a child or young infant requires admission or referral, that is, if it falls in pink classification, it is important that the essential treatment is offered to the child or young infant before admission or referral. If the child or young infant requires specific treatment, that is, if it falls in yellow classification, develop a treatment plan, administer drug to be given at the facility, and advise on treatment at home and counsel the mother and caregiver accordingly. If there is no serious condition and it has been found to fall into the green classification, advise the mother and caregiver on care of the child at home as we discussed earlier. So the next step is counseling. If the follow-up care is indicated, teach the mother or caregiver when to return to the clinic for follow-up. Also teach the mother and caregiver how to recognize signs indicating that the child or young infant should be brought back to the facility immediately. Follow-up. Some children or young infants need to be seen more than once for a current episode of illness. Identify such children or young infants, and when they are brought back, offer appropriate follow-up care as indicated in the IMNCI guidelines, and also reassess the child or young infant for any new problem. The guidelines also aim to empower healthcare workers to correctly interview caregivers, provide counseling for appropriate preventive and treatment measures, and correctly counsel the mother about her own health. So now we will take the example of pneumonia, and we will see how these steps are applied in this case. This is the IMNCI plan for 2 months to 5 years of a child. So in the first step, we assess and we ask the mother what the child's problem are. Determine if this is an initial or follow-up visit for this problem. If follow-up visit, then use the follow-up instruction on treat the child chart. If it the initial visit, assess the child. Then we need to classify, use all the boxes that match the child's symptoms and problems to classify the illness, and then you need to identify the treatment. So for assessment, first we need to ask the mother if the child is able to drink all the journal danger signs. Does the child vomit everything? Has the child had convulsion in this illness? And you need to look if the child is lethargic or unconscious, and is the child is having convulsion, or if yes, then you need to treat it immediately. So the upper part of this portion, it refers to the very severe disease. As you can see, it is pointing towards the right side of the column, and the upper part of the right side of the column shows that the patient has a very severe disease. So we will treat the patient accordingly. Then if there is no journal danger sign, we can ask the mother about main symptom. Does the child have cough or difficult breathing? If yes, then you can ask for how long. And you need to look, listen, and feel. You need to count the breathe in 1 minute. Use respiratory rate timers where available. Look for chest in drawing. Look and listen for stridor. Look for and listen for wheeze. Check for central cyanosis and check for oxygen saturation using pulse ox. And you need to check the level of orientation, if the child is alert, voice, patient is responsive to pain or is and is unresponsive. If wheezing with either chest in drawing or fast breathing, assess of possible asthma. If wheezing, assess for possible TB disease. So all of this, then classify the child to the next three categories, which shows severe pneumonia or very severe disease. And then the yellow portion is showing the child with the pneumonia, in which the patient will have the chest in drawing in a calm child, or fast breathing, or no signs of severe pneumonia. And in the green portion, it shows that there are no signs of severe pneumonia or severe disease. So it will be no pneumonia. That will be a simple cough or cold. So treat the child accordingly, the plan given in the same schedule of IMNCI. After in so in the first column, in the first step, you assess the child, you classify the child into the either pink, green, or yellow category, and then you offer the treatment to the child as per the plan. And in the next step, you ask about the immunization status of the child, which is also present in the IMNCI. So it is involving all the vaccination from birth till 18 months of age. And then you also offer the child with vitamin A and deworming strategies. And you also assess the child for other problems that the child may have. So make sure that the child with any journal danger sign is referred after first dose of an appropriate antibiotic and the urgent treatment. So you will not refer a child without giving any referral treatment. And also, you need to assess the mother's and caregiver health needs, to nutritional status and anemia if present in mother, the contraception, check the mother's HIV status, screen for cancers, e.g. breast cancer and cervical cancer, check the mother's psychosocial support, check hygiene practices of mother, and check assess the mental status. So, the next step, after treating the patient, you counsel the mother when to return to the health facility immediately. So, the red in this picture, the red part, which is on the left side of the picture, is showing all the journal danger sign which needs immediate return to the health facility. While on the right side of the picture, there is a chart which showing that you can give good home care to your child at home. So, the danger signs is if the child is again not able to drink or breastfeed, he becomes sicker, it develops fever. If the child with a cough has fast breathing or difficult breathing, and if the child of diarrhea has blood in stool, or is not drinking or eating properly, or if a baby is small and is breastfeeding, illness is not and is only breastfed and he's not breastfeeding properly, feeling unusually cold, that is hypothermic, or the palms and soles of appear yellow. The lower signs are basically for the child of is for neonates actually. So the home care is needed for any sick child if the child is breastfed and the instructions are given for a sick child, exclusive breastfeeding infant, and then you need to make sure that the young infant is kept warm at all the time, and he is exclusively breastfed till 6 months of age. And then you counsel the mother about her own health. If the mother is sick, provide care for her or refer her for the help. So you need to check the mother as well. You need to advise her how to express milk from the breast if separated from the baby for more than 1 day, as well advise her to eat well and to keep her own strength and health. Encourage male involvement in reproductive and child health care. Check her immunization stated in and check vitamin A stated to be given if the within the 6 week of delivery, and make sure she has access to the breast examination and cervical cancer screening, family planning, and counseling on STI and reproductive tract infection. Also, the important component of MNCI is that it covers HIV as well. If the mother is HIV positive, emphasize on importance of early testing for the child and enrollment into HIV care. If child is positive, emphasize on the importance of adhering to HIV treatment for both mother and child. Refer mother for HIV care and support if services are not offered in facility. Encourage parent to seek voluntary counseling and testing, and re-emphasize in the importance of safe sex and early treatment of STIs. And if the baby is less than 2 months, so you need to ask the mother about her logia, about her perineal care, ask about the C-section scar where applicable, and if the mother is on RT or other ART or any other medication, you need to counsel her on compliance. And the last component is the follow-up. So you need the care of child who returns for follow-up using all the boxes that met the child previous classification. If the child has any new problem, assess, classify, fully treat so as the which is present on the assess and classify schedule. So for pneumonia, the follow-up is usually given after 2 days. Check the child for journal danger sign again. Assess the child for coughing or difficult breathing. Ask again if the child is breathing slower, if there is less fever, and if the child is eating better. So you need to give the treatment accordingly. If any journal danger sign is present, so you need to give a dose of second line antibiotic, then admit the patient or refer urgently to hospital. If chest indrawing, breathing rate, fever, and eating have not improved, change to again the second line antibiotic and admit or refer the patient. And if breathing gets slower, there is less fever, or the patient is eating better, so you need to complete the advise the patient to complete the 5 days course of antibiotic. So what IMNCI offers, it offers evaluation, thoroughly assess and classify every child patient, care initiation, start treatment promptly with counseling and medication. It provides critical care, provide early treatment and clear referral guidelines for serious disease management. It leads to it can handle cases directly when referral is not possible. What IMNCI does not offer, it does not handle critical illnesses in cases in children such as severe pneumonia, serious febrile condition, advanced malnutrition, prolonged severe diarrhea, young infant with sepsis, and severe jaundice. So in all these cases, you need to refer the patient. And it does not provide comprehensive newborn care immediately after birth. It does not manage birth asphyxia cases, and it also does not include emergency triage and treatment protocols. So then there is a concept which is known as facility-based IMNCI. FIMNCI represent the fusion of traditional IMNCI program with the facility-based care packages, creating a unified approach. Since November 2009, IMNCI has been rebranded as FMNCI, now incorporating additional elements such as management of asphyxia and care of sick newborn within the healthcare facilities. It retains all the original components of IMNCI while addressing critical newborn care at the facility level. Many healthcare centers, including 24/7 primary healthcare centers, first referral units, community health centers, and district hospitals, often lack pediatric specialists to manage referred sick newborn and children. So FIMNCI training is designed to equip medical officers and nursing staff at these facilities with the necessary skills to deliver specialized care effectively. So the difference between the IMNCI and facility-based care in core competencies is that IMNCI understand the IMNCI process and rationale and know how to use the IMNCI chart, communicate with caretaker, and danger sign in children and severe sign in newborn and young infant. It has not many essential procedures. It deals with the malnutrition and anemia as well, and immunization and vitamin A supplementation, and infant and young child feeding practices. While the facility-based care provides care at birth, it provides emergency triage and treatment by treating asphyxias, and it uses essential equipment, and it provides essential procedure as well. and it can treat severe acute malnutrition, and again it guides about the infant and young child feeding practices. So the components of FIMNCI is skill-based training, enhancement of family and community practices, and health system improvements, logistic manpower, referral mechanism. The next is Community IMNCI. The Community IMNCI represent component 3 of the integrated management of the childhood illnesses package, is focusing specifically on community and household level interventions. Its primary goal is to improve family and community health practices by promoting behaviors and actions that have the highest potential to enhance child survival, growth, and development. CIMNCI emphasizes strengthening the connection between formal health services and the community, ensuring that the health initiatives are supported and reinforced at the house level. It aims to improve selected family and community practices such as nutrition, hygiene, timely care seeking behavior, and immunization, which are the critical for child health. Additionally, CIMNCI supports and empowers community based activities and volunteers, fostering local ownership and sustainability of child health programs. So the components of CIMNCI is promote child growth and development, prevent disease, provide appropriate home care, seek care outside the home when needed. And then the last is IMNCI Plus. So it integrate all the components that includes the caretaker care at birth, immunization, the behavioral change communication and community participation, health system strengthening, and implementation of IMNCI at the level of facility outpatient, facility care, outpatient care, or inpatient care, or at the level of community, that is home and community level, preventive, promotive cares, and management of mild illnesses. So integrate all the three types of IMNCI, including this with this strengthening of health system as well as the behavioral change communication therapy for community participation. So IMNCI in Pakistan, the integrated management of childhood illnesses in Pakistan is a comprehensive strategy adopted in 1998 to reduces the childhood mortality under fight by focusing on both facility-based care and community-level practices. In 2010, the strategy was upgraded to integrated management of neonatal and childhood illnesses (IMNCI), previously IMCI, to place a greater emphasis on the neonatal period. It is adapted to national guidelines and includes training for healthcare workers, including lady health workers, to improve quality of care. The IMNCI training coverage in Pakistan is unfortunately not uniform. The overall coverage rate is 24 to 45%. Sindh province has the largest pool of trained healthcare workers and facilitators, courtesy with the help of partnership by Norway Pakistan Partnership Initiative and PPI. So challenges, the major challenges include in the implementation of IMNCI is again the shortage of trained staff, lack of regular supervision, medicine stockouts, weak referral system, high workload, limited community awareness, and again the financial and administrative constraints, which also affect the sustainability of the program and its implementation. Recent updates. This was an article which was published in 2024, and it says that the perspective of healthcare workers on integrated management of childhood illness in Pakistan. It was basically a qualitative study in which a phenomenological approach was used. So a qualitative phenomenological study was conducted to explore the perception of healthcare workers about standard and distant IMNCI. 4 focus group discussions were conducted with previously selected 26 healthcare workers, which were IMNCI trained from 26 basic health units of Aptabad district in Pakistan. So 5 themes that emerge are inexorable health-seeking behaviors, IMCI being a comprehensive algorithm for consultation, a tedious protocol, scaling up protocol to specialist and private practitioners, and administrative insufficiency by the Department of Health. Improving in case management skill of healthcare workers was reported as a result of IMCI training. So it concluded that the IMCI program needs administrative support, regulation to control polypharmacy and provision of drug without prescription, and a curb on political and bureaucratic interference. Coming to the multiple choice question. The first question is, a child with cough and fast breathing is classified as yellow. What is the appropriate health action? A, immediate referral. B, home care only. C, treat at facility and counsel. D, ignore symptom. E, give vitamins only.
C.
Yes, C is the right.
D.
No, C is the right answer. If the patient falls in a green category, then it is advised for home care. As the child is following in a yellow category, so we need to treat the child at facility and counsel the mother or caregiver. The second MCQ is which indicator best measure IMNCI impact at population level? A. OPD attendance, B. Under 5 mortality rate, C. Bed occupancy, D. Staff turnover, E. Hospital revenue.
B.
Yes, B is the right answer. The ultimate goal of IMNCI is to decrease the under 5 mortality and morbidity. The third MCQ is a caregiver is poorly counseled about danger sign. Which IMNCI step was neglected? A. Assessment, B. Classification, C. Treatment, D. Counseling, E. Referral. So the right answer is D. We need to counsel the patient about all the danger sign of the condition. The fourth FCQ, a mother reports that her 3-day-old baby is not feeding well and it feels cold. What should be done first? A. Give paracetamol. B. Counsel mother. C. Refer urgently. D. Prescribe vitamins. And E. Observe 24 hours.
C.
Yes, as the baby is now hypothermic and is not feeding as well, which is a danger sign. So we need to refer the baby. The fifth MCQ is a prevents reports low IMNCI coverage. What is the best policy response? A. Increase tertiary care hospitals. B. Expand training and supervision. C. Reduce community programs. D. Privatize services. E. Closure rural health centers.
B.
Yes, B is the right answer. The sixth MCQ is a village reports late hospital visits. The best IMNCI solution is A. More hospital. B. Community awareness. C. Private clinics. D. Fee reduction. And E is insurance.
B.
Yes, B is the right answer. Because the IMNCI cover this component as well that we need to educate the community about early health seeking. The seventh MCQ is which factor most affects the IMNCI sustainability? A. Media coverage. B. Hospital size. C. Regular supervision. D. Number of specialists. E. Private sector.
C.
No, the right answer is C. The IMNCI demands for regular supervision and training of the health staff for its sustainability. The eighth MCQ is IMNCI differs on disease-specific programs because it A focuses on hospital, B manages on one disease, C address multiple conditions together, D requires specialist, E ignores prevention.
C.
Yes, C is the right answer. It addresses multiple conditions together, the disease component as well as the immunization, nutrition, feeding practices, and also the health of the mother. The ninth MCQ is an evaluation shows that IMNCI trained staff correctly classify illnesses, but child mortality remains high. Which gap is most likely responsible? A. Poor assessment tools, B. Inadequate referral linkages, C. Lack of vaccines, D. Excess documentation, E. Overtraining.
B.
Yes, B is the right answer. The last MCQ is which situation best reflects the failure of integrated principle of IMNCI? A. Treating pneumonia and malnutrition together. B. Referring service severe cases early. C. Giving vitamin A. D. Counseling on feeding. E. Managing diarrhea without assessing nutrition. So the right answer is E because IMNCI demands an integrated approach. So if we manage the patient with diarrhea without assessing the nutrition status of the child, so it represents the failure of the integration of IMNCI. This is the key to all the MCQs. These are the references. This is the official YouTube channel of the Institute of Public Health. Recording of this presentation will be uploaded.
Those who are their mic open, off their mics till this class ends. Today it is a very important topic.